Feeling unwell with a sore throat, cough or cold? You might think an antibiotic may help, but these common symptoms are usually caused by viruses, and antibiotics only work against bacteria. So sometimes antibiotics are unnecessary. Let's explore why and see how using them wisely helps protect our health. Viruses are tiny germs that invade your body's cells, causing respiratory illnesses like colds, coughs, flu, and sore throats that clear themselves over time. Bacteria are living organisms that grow and multiply. Many bacteria are harmless or even helpful, but some can cause infections, and that's when antibiotics are used. Taking antibiotics when they're not needed can be harmful, as the antibiotics affect the good bacteria that naturally live in your body. When exposed to an antibiotic unnecessarily, these good bacteria may adapt to resist its effects and multiply and pass their resistance to other bacteria, including ones that might cause serious infections and a dangerous condition called sepsis later on. Sepsis occurs when the body produces an out-of-control response to an infection, which can cause organ damage and death. Over time, the resistance makes infections and sepsis harder to treat. These tougher, drug-resistant bacteria, also known as superbugs, pose a serious threat to future health. Antimicrobial resistance occurs when bacteria survive antibiotic treatment and continue to grow. In some cases, infections caused by resistant bacteria and sepsis may not respond to any available antibiotics. That's why it's so important to only use antibiotics when they're truly needed. So, when you have a cold or flu symptoms, don't look for an antibiotic. Rest, drink fluids to avoid dehydration, and speak to your pharmacist. They can advise on the best way to ease your symptoms. Medicines like paracetamol or ibuprofen can help make a big difference to how you feel. To avoid spreading the virus to others, sneeze or cough into a tissue or your upper sleeve and clean your hands regularly with hand sanitizer or soap and water. These small steps help to protect those around you. Most viral infections get better on their own. Cold symptoms usually clear within about 2 weeks, and a cough can last up to 3. But if your symptoms aren't improving or are getting worse, contact your GP. They'll assess your symptoms and decide whether any treatment is needed. If your GP does prescribe an antibiotic, take it exactly as instructed and finish the full course, even if you start to feel better, as stopping too soon can leave some bacteria behind, giving them a chance to survive, adapt, and become resistant. So remember, using antibiotics wisely will help ensure they work when we really need them, now and for future generations.